pain. It's not pleasant, and unfortunately every one of us will experience some type of acute pain during our lifetime. Whether it's a headache, menstrual cramps, joint muscle pain, or even the occasional minor athletic injury. There are also those individuals that experience chronic ongoing pain from perhaps maybe a past injury, illness, genetic anomalies, or a predisposed condition. And according to a survey done in 2012 by the National Health Institute, about 11.2% or 25.3 million Americans suffer from some form of pain every day for a period of 3 months or longer, and 17.6% suffer from extreme pain. Chronic or extreme pain can greatly hinder people's quality of life, along with their inability to function and perform daily activities, especially in this fast-paced, high-stress world that we live in. Hi, I'm Michelle Tonkin, MD, a naturopathic doctor whose heart is to help others on their journey to abundant health. Thank you for joining me on the Healthy Solutions for All YouTube channel for today's episode, Pain in the Back, Natural Solutions for Back Pain. So first off, what are some common causes of pain, especially back pain? Common causes can be things like accidents and traumas from car wrecks, falls, slips, injuries, like sport injuries, infections, like Lyme, fibromyalgia, chronic fatigue. These are viral and bacterial infections that can cause pain issues. And misalignments of the spine or spinal issues can also cause back pain. So what can we do naturally to help our bodies deal with pain, like back pain? The first thing we want to look at is supplements. And the first supplement we want to talk about is CBD. CBD, or cannabidiol, is from the cannabis plant. And it's available right now in forms like gummies, oil, sprays. It's everywhere we turn. Well, this plant comes in two main varieties known as cannabis sativa and cannabis indica. And marijuana can come from either variety of the cannabis plant. Hemp, however, is derived only from the cannabis sativa plant, and hemp is what CBD comes from. Hemp itself contains only small amounts of THC, and THC is the compound which causes those psychoactive effects of marijuana or cannabis. So CBD can be a promising agent for those looking for the benefits of marijuana or cannabis without worrying about the THC. The following chart shows all the benefits from CBD, and this chart is from the CBD Awareness Project. As you can see, CBD is good for relieving arthritis pain, chronic pain, nerve pain, inflammation, reducing muscle spasms, MS symptoms, helping with anxiety and depression, and even helping with sleep quality. So a product that we recommend that has CBD in it is called Entomb Patches by Isagenix. It's the first of its kind, and it's actually a transdermal patch which supplies about 2 milligrams of CBD oil directly to the body. It also contains natural pain-relieving ingredients like white willow bark, cat's claw, and CoQ10. So those who are sensitive, maybe with CBD oils, liquids, actually do very well with this type of product as it bypasses the gut and goes straight to the source of pain, and also great for those who are having issues with sleeping at night. So I actually have some CBD patches from Isagenix right now on my knee, and it's helping with an old knee injury that I have. I also use these CBD patches when I'm dealing with menstrual cramps. So I actually use some of the patches on that area, and I've had great success with using it so far. I haven't had to use hardly any things like Tylenol or anything like that. So it's a great alternative to helping to relieve pain without having to turn to Tylenol or Advil or ibuprofen. The next supplement we want to talk about is Kumanda. Kumanda comes from the bark of the Capisandra augustifolium tree, which is found in the Amazon basin. It's an antimicrobial and it's been used by the indigenous people in that region for hundreds of years. As you can see, these are the medicinal properties on the slide here. Testing was done on Kumanda, and what they found about Kumanda is it had anti-inflammatory effects similar to ibuprofen, and it can be used to reduce inflammation. And it's really good also against a natural antiviral and antibacterial and antifungal. So if you're dealing with issues like candida, if you're dealing with issues like Epstein-Barr, other types of viral or bacterial infections, Kumanda is also great for that. Next one we want to talk about is colostrum. And this is from a bovine source, but colostrum is the pre-milk fluid that's produced by the mother's mammary glands during the first 72 hours after birth and provides those life-supporting immune and growth factors that are needed for the health and vitality of newborns. And colostrum from the bovine or cow source very closely mimics what we would get from our mothers. So colostrum actually helps us to support our bodies with human growth hormones, which helps us with tissue healing and repair, which is very necessary, of course, when you're dealing with injuries, and also helps support our immune system with immunoglobulins. So it helps support with nerve and muscle and bone tissue healing, and also immune system support. So throw in that shake of yours in the morning or some yogurt. Colostrum is going to help benefit your body in healing. Next is essential fatty acids, or EFAs. There are two classes of EFAs, known as omega-3s and omega-6s. And basically, the EFAs are called EFAs because they are essential for our health. EFAs come directly from the foods that we eat, and the fatty acids help us in a number of ways, from helping to provide for energy, hormone production, and even absorbing certain vitamins and minerals. And the body is able to make most of the fatty acids it needs from other fats, but is unable to synthesize omega-3 and omega-6 fatty acids, which means that we have to actually supplement them in our diet. So good sources of EFAs are going to be like your flax oil, primrose oil, borage oil, fish oils, hemp seeds, etc. And even acai berry juice has EFAs. So EFAs are shown to be really good for helping with skin issues, heart disease, arthritis, PMS, also relieving inflammation and helping to reduce joint pain. So get those EFAs in your body. The next supplement we want to talk about is a fruit called noni, also known as Miranda centrifolia. It grows on a shrub-type tree about the size of a medium avocado pear, that's its size, and it's known to the Pacific Island people as a beneficial or healing food. Typically, noni is taken internally as a drink to enhance function and support overall good health, and this healing fruit has been used successfully for over 2,000 years in countries like Polynesia, China, and India. As you can see, these are some of the benefits of noni fruit below. It's an immune booster, stimulates the digestive system, it's an antioxidant, and also it is also good for relieving pain, about 75% as effective as morphine sulfate. Pretty amazing. It's also anti-inflammatory, antibacterial, anti-cancerous, etc. So the brand we recommend is a noni called from Hawaiian Health Noni. It comes in noni fruit leather. It also comes in a lotion that you can use topically. The fruit leather you take internally, and it's really great for relieving pain. I use for PMS or other types of issues. And the lotion is also great for any kind of issues you might have with pain, inflammation, or even certain skin conditions. It's also great against. Next is Takuna. Takuna is from the bark of the Stricosa tree found in South America. It's an antimicrobial and it's a very powerful antiviral. Researchers in Israel have tested Takuna and also found it to be effective against Asian bird flu. And as you can see here on the slide, it's also good against things like herpes zoster, Epstein-Barr, cytomegalovirus, HPV, things like that. Also, we talked earlier about how infection can be a cause for pain in some people, like Epstein-Barr, shingles, HPV. So Takuna is one of those things that if you're dealing with any kind of chronic issue like that, it's going to help as it's a natural antiviral. It also showed that it was 73% as strong as Velodine as an anti-inflammatory. They use that particular drug to treat pain from osteoarthritis or rheumatoid arthritis. So it's a really good, effective antiviral and an anti-inflammatory. Next, you want to look at some therapies. You can consider acupuncture, chiropractic, or even therapeutic massage. So acupuncture has been gaining popularity for the last decade or maybe even 2 decades. It's been used to treat a number of health conditions from fibromyalgia to chronic fatigue, headaches, migraines, back pain, sciatica, frozen shoulder, insomnia, arthritis, PMS, etc. The basis of acupuncture is that the body has an energy force running throughout. Okay, this energy is known as chi. Chi travels through the body along pathways called meridians, and it's believed that this flow of energy, if it's insufficient or unbalanced or interrupted, illness may occur. So they put small needles at specific points to encourage the energy to come back into balance and to unblock stagnation in the body. And a lot of people believe that acupuncture is also successful because it encourages the body to release endorphins, or those pain relieving hormones, to those specific areas of treatment. So this type of therapy has been around for thousands of years, and they have shown, as you can see on this diagram here, different points that actually relate to different points in the body. So our body's all interconnected. So when there's one area that is out of alignment in the body, it affects other areas. So it's really important that we deal with unblocking those areas of stagnation to bring healing to the body. The other therapy is chiropractic. And chiropractic, also known as hands-on joint manipulation, has been used for many years, and it's being used to have success to bring relief of headaches, trauma, stress, back pain, etc. So what happens is that after you get into the proper position, the chiropractor creates a tension around the offending joint, the joint that's out of alignment, and then applies pressure to return to the proper position. And the popping noise that you hear, the cracking, is actually that generated pressure that's built up inside the joint. So when the joint goes back into the proper position, the pain is relieved and proper function is restored. So chiropractic is an addition to any health program, and an excellent one, and I highly recommend it. Another tool that we recommend is something called spinal decompression therapy. Now there are things like decompression tables, etc., but we really suggest that you go to an office that offers something called decompression therapy via machine like the DRX 9000, as you can see on the slide here. It's, in my personal opinion, this is a safer and more effective method of decompression, as it's controlled by a machine and not by a human, which allows a certain degree of safety while also accomplishing making sure you're getting the proper treatment that you need in the proper time and the proper tension. So spinal decompression is used to help manage and treat conditions like chronic back pain, sciatica, etc. And it's a great non-surgical and drug-free solution that has shown to have great success by helping people get pain relief from conditions like, and you can see on the slide here, sciatica, herniated bulging disc, neck and back pain, arthritis, pain in the arms or legs, people that are just coming out of surgery, at post-surgical patients, and spinal stenosis. So how does spinal decompression work? Well, conditions like the ones we previously mentioned can cause compression to the vertebrae in the spine. And when the spine is compressed, it can put pressure on the nerves surrounding the spine, which can cause irritation. Compression can also be responsible with tearing or rupturing a spinal disc. And if this occurs, the soft disc material that separates each spinal bone can be damaged. Discs that are already deteriorated can also have further pressure put on them from a weight, trauma from an accident, etc. And in cases that are severe, the soft pulpy center of the disc can leak out, so to speak, which can also cause a lot of pain. So spinal decompression helps to alleviate pressure and enable your body to heal by gently stretching the spine. And each sequence helps the damaged disc give nourishment, flush out cellular waste, and experience reduced pressure. The healing, however, can take time, as your discs are always under weight-bearing pressure. And so the goal of spinal decompression is to actually promote healing, which allows the pain to reduce dramatically so people can get back to a more active lifestyle. So I highly recommend searching out someone in your area that maybe is a chiropractor that has a machine like the DRX 9000 that can help you deal with pain that you might be having in your back. Lastly, we want to talk about a therapy called massage therapy. It's not a new modality. It's been around for literally thousands of years. And ancient Chinese medical texts have written over 4,000 years ago describe this practice as a healing art. So in Chinese medicine, massage is actually known as acupressure. Massage and acupressure both work with the body's own healing systems. They promote healing to the nervous system, blood vessels, and lymphatics. And the key here is removing stagnation. Again, it's removing anything that's blocked in the body. A massage actually allows the stagnant muscle to function more appropriately and allows more circulation to the area, which in turn helps to relieve inflammation, pain, and of course any toxin buildup in the body. It also helps to reduce stress, and we know that stress is a major contributor to health problems, so massage is also a great tool to help you deal with pain. Now we want to talk about some alternative therapies to help you deal with pain, especially back pain. The first one we talk about is cold laser therapy. Now cold laser therapy has been around since actually the 1960s, but it was actually first introduced in 1916 by Albert Einstein, who was the first to conceive the theory of light amplification through stimulated emission of radiation, also known as laser. So the cold laser therapy we're talking about today, or low-level therapy, laser therapy, is actually a specific treatment that utilizes certain wavelengths of light to help accelerate and bring healing to the body tissue. This therapy is used in a variety of health conditions from acute to chronic and has found to be overall helpful in eliminating pain, swelling, reducing spasms, and increasing overall function. So a cold laser is a handheld device, and you can see on the slide some of the cold lasers. It's about the size of a flashlight and is usually used by a trained clinician, doctor, or chiropractor. What they do is they have the laser over the site of the injured area for a period of time, maybe vary from 30 seconds to several minutes, depending on the size of the area being treated and severity. And during the treatment, these non-thermal photons of light are able to pass through the skin's layers, the dermis, epidermis, and the subcutaneous tissue or tissue fat under the skin, and it has the ability to penetrate about 2 to 5 centimeters below the skin. And once the energy has passed through the skin, reaching the target area, it's absorbed and it interacts with the light-sensitive elements present in the cell. So some people compare this to like photosynthesis in plants, where sunlight is absorbed by the plants and then it's converted to usable energy. In the same way, our cells absorb this light, which then triggers a series of events which is believed over time to bring healing to the damaged injured tissue and actually reduce pain and inflammation. So there are actually 3 categories of laser treatments. There's a class 4, a class 3B, and class 3A. Class 4 is the one that most people are familiar with. This is the one that people will use in surgery to cut tissue. This is the type of therapy is actually very different from class 3B and class 3A, which are non-surgical lasers and are painless and non-burning and non-cutting. The class 3B and class 3A low-level lasers are not equipped with intensity to damage cells, but actually bring healing. And class 3A helps heal superficial wounds, and class 3B, however, goes a lot deeper to penetrate issues beneath the skin's surface, but not cause any damage. So, and here's the conditions that low-level lasers can work with to help with the body. Things like carpal tunnel, back pain, muscle joint pain, neck pain, stiffness, muscle spasms, wound healing. Treatment time is going to depend on the condition and severity of the condition. Most clients should expect about anywhere between 8 to 30 treatments, depending on their condition. The next therapy we want to talk about is called far infrared. Now, for centuries, scientists have known that plants are dependent upon sunlight for photosynthesis that we discussed earlier. But only recently has science recognized the similarities between humans and plants and their dependence upon light. Now, solar energy comes from the sun, which covers a broad energy band including far infrared, infrared light, visible light, ultraviolet, X-rays, and gamma rays. But the greatest amount of the sun's energy output is the infrared segment of the spectrum. And this band of light, of course, is not visible but can be felt as heat. Far infrared actually penetrates deeply with a very uniform warming effect, and all humans send and receive far infrared waves. When any tissue in the body is exposed to far infrared waves, whether it's radiated by sunlight or reflected by specially coated fabrics or ceramic panels, there is a rapid increase in warmth. Now we can see these are the benefits of the far infrared waves below. Things like reducing muscle spasms, increasing blood flow, removing toxins, helping reduce swelling and inflammation, and reducing soreness. Far infrared technology is available nowadays from everything from body wraps to blankets to clothing to even saunas. And use of this technology directly on the muscles actually reduces lactic acid, and on a larger scale can reduce the general body acidity. And one of the reasons why far infrared is so beneficial is its ability to remove toxins, which are of course at the core of many health issues. The one that we recommend is called the Biomat, and it utilizes amethyst as well as charcoal to help with far infrared healing as well as reducing toxin overload. It also is a heated far infrared technology, and so it's really great. I use this, my parents use it, my cat uses it to help us with relaxation, helping us to heal quickly from different types of injuries or stress or muscle fatigue, and it's just a great overall product. So check it out. Lastly, we want to talk about something called on-the-med biofeedback. On-the-med comes from the Latin word wave, and on-the-med actually sends finely tuned frequencies to the patient according to their condition. On-the-med is an electromagnetic frequency device, also known as PEMF, pulse electromagnetic frequencies, and also uses sound waves. And it delivers this type of frequency based on the patient's pulse. So if I'm in my home office treating somebody on the on-the-med machine, I am feeling their pulse to determine what frequencies the body needs. And as I'm scoring through the various frequencies, when it hits a frequency the body needs, the pulse will jump in intensity, not in rate, but in intensity, which will let me know, or the practitioner, that that particular frequency is something the body needs for healing. So the on-the-med device offers 174 preset protocols of different types of bundle frequencies to address common imbalances in the body, and also has individual frequencies to address more specific concerns. Also has modules and frequencies to help with organ function, balancing the body, helping the body to eliminate microorganisms like viruses, bacteria, fungus, parasites, as well as help to absorb vital nutrients. So the whole goal of on-the-med biofeedback is to move the body towards a state of balance and to help the body to heal at the cell level. On-the-med provides remarkable results for a number of conditions, as you can see on the slide here. And to find an on-the-med practitioner in your area, go to onthemed.net. Well, thank you so much for joining me today on the Healthy Solutions for All YouTube channel. I hope you gained some valuable information that can benefit your health in some way. And please feel free to pass on this information to family, friends, anyone you think might benefit. And please don't forget to hit that like button and subscribe to our channel. And may the Lord bless you, keep you, and make his face shine upon you. Thank you so much for joining me here again today. Until next time.